Welcome. My name is Daphne Broadhurst. I'm a clinical nurse specialist with Infusion Excellence Consulting. You've learned what the Easypump is and some of the key tips to keeping everything clean. You're almost ready to start your pump. In this video, you'll learn how to get set up to start the pump. In the previous video, you learned to always work in a clean, quiet area. Scott has already cleaned the table. He's washed his hands. You need to gather your supplies. It helps to keep everything clean if you put your supplies in a clean plastic container if you have one. You need your flush or saline syringes using the number that your healthcare provider taught you to use. We're using 2 for this demonstration. Alcohol swabs or the kind of disinfectant swab you were given. Tape. And of course, you need your Easypump that is now warmed to room temperature. And it's very handy to have hand sanitizer in case your hands touch your face or something that might contaminate them. Look at the label on the pump. You want to make sure that it's the right one for you. Is it your name? Is the medicine name right? Is the dose of medicine, such as 2 grams, right? Check the expiry date to make sure it's not passed. Now look at the Easypump. Is the fluid clear? Is there anything floating in it? Are there any leaks or damage to the balloon or tubing? Is the clamp on the tubing closed? Are the caps in place on the top and bottom of the pump and at the end of the tubing? Look at your flushes. Is there any damage or leaking? Are the caps at the end of the flush in place? If the answer is no to any of these questions, do not use that item. Get another one and check it to make sure it's okay. Every time before you use an Easypump, what do you need to check to make sure it's okay to use? You have to make sure it's at room temperature. You're going to check to make sure that there's no leaks or damage to the pump, and make sure that it's not past its expiry date, and of course check the label to make sure it's the right medicine for you. You've just checked to make sure your Easypump is okay to use. Now you need to make sure that your IV or PICC is okay. First, look. Is it red? Is your arm swollen? Is there any fluid under the bandage? Is the bandage loose or dirty? Now touch it and the vein where the IV is. Is it sore or does it feel warm to touch? If not, that is, if your bandage is sticking well, everything looks clean, and there's no discomfort, you're ready to start your medicine. However, if you think there's a problem, make sure you call your healthcare provider. You've checked that your IV looks good. Now you need to check that it is working well. You need to flush or rinse the IV or PICC. If your IV or PICC has a clamp on it, open the clamp. Take the flush out of its wrapper. Hold the flush with the tail end down. Do you see any air bubbles? If so, tap the flush against the table. This will send any air bubbles up to the top. Sometimes you have to flick the side of the flush if bubbles are sticking to the sides. You now need to break the airlock in the flush. Loosen the cap. Just twist it counterclockwise 1 turn, but leave the cap on. Push your thumb gently on the tail end of the flush. This will push air up out of the syringe. You'll hear a click and see a bit of fluid coming out of the flush at the top. Set the flush with the cap still on in your container. Before you flush, you need to scrub the hub. Rip open the alcohol wipe wrapper across the top of the package. Pick up the alcohol wipe in your dominant hand. Hold your IV cap in your other hand. Scrub firmly for 15 to 30 seconds. Make sure you clean the top and then the sides to remove any germs. And also make sure that your finger doesn't touch that clean connector that you're cleaning. You now have to wait for 15 seconds to let the alcohol dry and kill any germs, or however long your healthcare provider showed you. This is now a key part, a no-touch zone. Make sure nothing touches this clean cap. If it did, you would get another wipe and clean it again. Now you need to flush your IV to make sure it's working well, that it's not plugged with medicine or blood perhaps. Pick up your flush, hold the IV in your non-dominant hand, unscrew the cap to take it off. The open tip of your flush is a no-touch zone. The only thing that can touch it is another no-touch zone. Screw the flush onto the IV. Push the flush in to the hub or connector and twist it gently in place. Now push on the tail end of the flush. Push stop, or squirt, squirt, squirt. This helps to rinse the IV well. You should also be feeling how hard is it to flush and make sure that there's no pain or leaking at your IV site. When the flush is empty, twist it off and set it aside. You now know that your IV or PICC is working well. You're ready to start your medicine. Before you connect your Easypump to your IV or PICC, let's review what you need to do every time to get ready to hook up your pump. Always check Easypump to make sure it's the right one for you. Check your IV site. Always clean your work area and your hands. Always scrub the hub of your IV or PICC. And flush your IV before you hook up your Easypump. Now you know how to safely prepare to use your Easypump. In the next video of this video series, you'll learn how to hook up, start, and then disconnect your Easypump. I'd like to thank Formative Pharma for their educational grant to support the development of this video. Thank you.